When a patient is diagnosed with lymphoma, the first question that comes to their mind is, why did this happen to me? Now we know that the exact etiology as to why a patient gets lymphoma is not known for the majority of patients. And therefore, we have to tell them that this is not true. Now, the next question that usually comes to their mind, which they ask me, is, can this be treated? And if it can be treated, will I be cured? In fact, for most people, that is the predominant question in their minds. Now, lymphoma is treated with chemotherapy, occasionally with radiation, and sometimes with an autologous stem cell transplant. Now, lymphomas are basically of two types, low grade and high grade. And for the high grade ones, we can offer a cure, and this is reassuring for many patients. For the low-grade lymphomas, many cannot be cured, but they can live relatively normal lives for long periods, even sometimes without any treatment or with simple treatment. For most patients, the worry is that if they cannot be cured, will they suffer a lot because of the lymphoma? Today's medicine allows us to control symptoms related to lymphoma like pain, fever, quite well, so that patients can be reassured that in fact, if we are unable to cure the disease, we can ensure that they remain comfortable and do not have any trouble. However, the silver lining is that among cancers, lymphomas are one of the most eminently treatable, and therefore there is a good possibility of cure. The question that often arises is whether patients would like to know all about the disease. I, for one, believe that knowledge is power, and knowing about the disease, agreed, can produce anxiety and tension and worry, but not knowing is even worse. So, having a clear understanding of what one can expect from the disease and its treatment, I believe certainly helps patients to handle the situation better. And my advice to most patients is to take each day at a time, to live each day fully and not worry about tomorrow.